Hi, so my name's Chris and I'm here at the MRC University of Glasgow Centre for Virus Research, and this is a short video about using maths to learn about viruses. Okay, so masks are an important part of public health in order to stop people from catching the coronavirus infection. So they have two functions really. The first is that they prevent you from infecting other people, and then with other masks they prevent you from getting the virus yourself. Okay, so this was a study that we did in collaboration with Addenbrooke Hospital and the University of Cambridge. And it was a study looking at healthcare workers who work on COVID wards. So that is people who, through their work each day, are coming into contact with patients who have COVID and are therefore at a much higher risk than an ordinary person of getting infected. The purpose of the study was to look at whether introducing a new kind of mask was beneficial for those healthcare workers. So there are two types of masks that we're thinking about here. The first kind of mask was what's called a fluid-resistant surgical mask. This is the kind of blue sort of rectangular mask that you might see people wearing and might associate with doctors and nurses. And the second kind of mask is what's called an FFP3 mask. So this is a mask which covers your whole nose and face, and which provides protection against aerosols. So it is very, very small droplets that you can potentially breathe in. And so the study followed on from a decision at Addenbrooke to give FFP3 masks to healthcare workers on these COVID wards. And the study had collected data of how many healthcare workers on each ward got infected each week. So we had data sort of from before and after the introduction of FFP3 masks. We wanted to know the answer to the question of were FFP3 masks useful for reducing the number of cases among healthcare workers on COVID wards. Okay, so mathematics is important because you're looking at data, so these are kind of random things. Somebody might or might not get infected on a particular day, and that could be because they're lucky or they're unlucky. They just happen to be in a situation where they get COVID. And so when we looked at the data for the first time, it looked at first sight as if wearing FFP3 masks did reduce the number of cases among healthcare workers on COVID wards. But you then have to ask the question, well, is that a change that could just happen by chance? You got lucky on those weeks? Or can we make a conclusion that there's some underlying cause, that actually using the masks is important, that it really is making a difference to those healthcare workers? In our model, we had data from two kinds of healthcare worker. So there are healthcare workers who work on COVID wards, and there are healthcare workers who work on other kinds of wards, so other wards in the hospital that weren't set apart for patients with COVID. So then each of those two kinds of healthcare worker had two kinds of ways of getting COVID. The first is just from the community. So just like anyone else, healthcare workers go to the shops, they might go to a restaurant, they might spend time with their family. And we call that sort of community-based risks. So healthcare workers outside of hospital can get COVID. And the rate at which that happens, we assume, is linked to the number of people in the community who have COVID. So if in the community there's a high number of people with COVID, there's a high chance that healthcare workers will get COVID in the community. And if there's not many people in the community with COVID, well then that risk is a much smaller risk. Now we assumed that both kinds of healthcare worker had the same community exposure. That is, they didn't particularly go to different kinds of restaurants or houses or wherever they went because of their job. And then the second kind of risk was a risk of getting coronavirus at work. So that is directly from a patient, or it could be from other healthcare workers on the same ward, having lunch with people together from the same ward, and all those sorts of things. And we divided those into two, so that the risk to a healthcare worker on a non-COVID ward was different from that to a healthcare worker on a COVID ward. So we have these two kinds of twos. We have healthcare workers on COVID and non-COVID wards, and then each of them is at risk from the community and directly from work. So to do the study in terms of mathematics, we used something called a Poisson distribution. And a Poisson distribution is named after a French mathematician from the 19th century, and it deals with the rate at which certain things happen. So you might imagine a road with cars going down the road at some sort of constant rate. You might say that there are 5 cars per minute driving down a particular road. And you go and stand by the side of the road, and you can ask the question, well, in any one particular minute, how many cars would you expect to see driving past you? And the answer to that is a Poisson distribution, assuming that the cars come at a constant rate. You would see an average of 5 cars per minute, but then some minutes you would see no cars, sometimes you might see 10 cars, and if you like, the chances of seeing a particular number of cars is described by a Poisson distribution. Okay, well, what we did was to apply a Poisson distribution to the numbers of cases to learn different rates at which healthcare workers got infected. So we had a community rate for each of the 2 kinds of healthcare worker, and then we had infection rates at work from being on the ward for each healthcare worker. And so what we saw was that when we looked at rates before and after the introduction of FFP3 masks on COVID wards, we saw that there was a reduction in the number of infections of healthcare workers on COVID wards. And using the mathematics, we could show that that wasn't just a case of getting lucky, so far as we can tell, but it seems to be a statistically significant result. And that is, we can see that there seems to be a lower chance of healthcare workers on these wards being infected when they wore an FFP3 mask. Okay, so our study seemed to show that healthcare workers working on COVID wards and with COVID patients would be better protected if they wore FFP3 masks. Now, our study is just one study and was based on one particular hospital at a particular time. But we say that maybe out of a matter of precaution, it might be good for healthcare workers in those situations to wear the better FFP3 masks. And then alongside that, we also call for more research into these kind of masks and whether they could be more useful for our study to be replicated and to find out more about this particular topic. Really with the question, is this a way in which we can protect our healthcare workers as they seek to look after us? Okay, so this has been a fun study to be involved in because of the number of different kinds of scientists who've been involved. So I actually loved maths at school, and I did maths at university, and now my work on viruses is quite built around statistics and mathematics and trying to see how we can use numbers to get in to learn more about viruses. But alongside that, I've been part of a team of medics and biologists and lots of different other researchers, and so in a way we've all come together in order to push science forwards, using our own expertise from different areas and bringing that together to promote understanding of science and public health.